Hi, I'm Dr. Sharmila, consultant obstetrician and gynecologist practicing in Vydehi Super Speciality Hospital on Vittal Malya Road. Polycystic ovarian disease is, or what is known as PCOS, is a significant public health issue which is one of the commonest cause of the hormonal imbalance caused in the fertile reproductive age group women. Usually it affects 8 to 13% of the women, and in that, so like almost 70% cases go undiagnosed, and it is usually more in few ethnicities where they have more severe problems, and usually it is related to the metabolic disturbances. It usually affects from adolescent to women in their 40s. Polycystic ovarian syndrome is a condition which affects the periods, fertility, hormones and the appearance. It does have long-term effects also. If you ask how many are affected, in 100 women, around 2 to 26 women may be affected due to PCOD. And the symptoms differ from patient to patient or individual. In few of them it may be less, and few of them they may be having more symptoms. The commonest problem with the patient comes to is with the irregular cycles or no periods, and increased facial hair growth, body hair growth, obesity, difficulty in reducing weight, and like gradual increasing in weight even though they don't consume much of food, and acne, oily skin, and difficulty in conceiving. That is the infertility. And they have long-term effects such as mood swings, psychological disturbances. Though many people come to us saying that on the ultrasound report, when we had gone for something else, we found that we have polycystic ovaries. When we say polycystic ovaries, it is the ovaries is bigger than the normal and they have more follicles than the normal and cyst filled with fluid. That itself is not the diagnosis for polycystic ovarian syndrome. They will be having, generally we take into consideration 2 or more other features, like when they have irregular, infrequent periods, they have facial hair or body hair growth, and with increased testosterone level. Clubbed with this, when they have the polycystic ovarian picture, generally we come into a conclusion, but it may vary because the symptoms may increase or decrease with their weight loss. They may have symptoms for a few days and their cycles may regularize when they reduce weight. So it may take a while to diagnose for us of the PCOD. There are a lot of long-term effects of PCOS. The first and the main thing being, when they have PCOD, they have increased insulin resistance. Increased insulin resistance leads to obesity and it leads to diabetes. When the sugars are not under control, it leads to diabetes. And obesity leads to other problems like hypertension and cardiac disease. Even though hypertension and cardiac disease are not per se due to the PCOD, due to the obesity and increased insulin resistance, they are at a risk of hypertension and cardiac disease. They may have psychological issues, they may have mood swings, they are more prone for endometrial cancers because of the thickened endometrium and what we call as the unopposed estrogen effect on the body, when they don't have the progesterone which is necessary to have a balance between the hormones. Having a healthy lifestyle can reduce the symptoms of PCOD, and there are many women who deal with their symptoms with lifestyle modification. When we say lifestyle modification, it means eat healthy, have a balanced diet, exercise regularly, at least 30 minutes a day for 3 times a week. Try to have whole meals like whole fruit and whole grains, and avoid caffeine, avoid excess salt, avoid excess sugar in your diet. With the balanced diet, lifestyle modification, keeping your BMI with 19 to 20 is also very important. When it goes above 30, they have to plan of reducing the weight. Reducing the weight has got very good effects in avoiding the long-term effects or long-term risks of PCOD. Like when there is weight reduction, insulin resistance is reduced. When insulin resistance is reduced, like it goes hand in glove, the risk of obesity reduces, the risk of hypertension reduces, risk of diabetes reduces. They'll start getting their periods regularly. Fertility rate improves. With reduction of weight, there is a overall feeling good effect, confidence increases, and it's a feel good factor. PCOD is a chronic condition. Once you get it, it is not curable. The only thing is we can help them with some amount of medications, with lifestyle modification and infertility treatment to overcome the symptoms. But medications alone doesn't have an edge over the treatment. it has to be with lifestyle modification. As I've mentioned earlier, with your diet, with your exercise, with not going into that obesity zone, it can be kept at bay. There are many women who have managed their polycystic ovarian syndrome symptoms without medication, with a good lifestyle modification. As I mentioned, like walk and taking care of themselves, and it does give a good effect. Without treatment, they can conceive. Without treatment, they can have periods regularly. In PCOS, each patient has a different need, and we categorize the treatment according to the age of the patient and what the patient is looking for. Definitely, we will treat all the patients who are getting very fewer cycles. When we say fewer cycles, it is less than 2 to 3 cycles per year. They definitely do need treatment to regularize their cycle. Apart from that, it depends upon, for example, we have got a lot of college going girls where we focus on regularizing their cycles. Then we have this reproductive age group women where we focus on them having a child. And then we have these people who have completed their family with a lot of health weight issues. Then we focus on weight reduction and getting the cycles regularized.